Hey guys, how's it going? This is Ulysses again with Amici Hospice with a quick lesson on documentations. So to start off, we are a hospice, guys. So with that being said, it is very important that we document decline. Hospitals, home healths, clinics, they're all going to document positive notes because they expect the patient to get better. They want positive results. Unfortunately, with hospice, it's the total opposite. Guys, for documentation, we got to justify the fact that they are on hospice, that they do need these visits, that they do need these medications, that they do need a bath nurse, right? And the only way to do it is to prove it through your documentation. Every visit, you want to ask the patient if there's any new symptoms that are happening with the patient. You want to make sure you write these down, guys. One very important thing that nurses always seem to kind of mistake is something as simple as like hypertension. They want to say the patient, vital signs are within normal limits. Nurses, we got to remember, the only reason the vital signs are within normal limits is because the patient is actually taking his medications for these symptoms. So we don't want to say no shortness of breath noted on the patient. One type of documentation could be, patient still continues to suffer from shortness of breath on exertion, controlled by breathing treatments, albuterol treatments every 4 hours via nebulizer, as well as puffers, as well as frequent rest breaks during ambulation. So these are all things symptoms that the patient does have, but are being controlled by medication, right? Even hypertension. Patient's blood pressure seems to be stable and within normal limits. That is not what you want to document on it. Remember, guys, we're trying to justify the fact that the patient needs our visits, needs our supervision. So one way would be, patient continues to have hypertension, which is controlled by lisinopril, 20 milligrams, daily, 1 tab PO 2 times a day, or whatever it is, right? So we want to on our documentation, we want to make sure that we note that the patient is having these symptoms, but they are controlled by the medications. Unfortunately, we want to document decline, guys. Negative. I can sit here and tell you everything that the patient doesn't have. Patient doesn't have headaches. Patient is not dizzy. We really don't want to hear about what the patient isn't having. We want to hear about what the patient is having, right? So I need you to list these problems. If it's insomnia, I want you guys to be detailed. Well, how many hours of sleep is he getting? Is he getting only 2 hours of sleep, 4 hours of sleep, right? If it's loss of appetite, I want to know how much he's eating and how much he was previously eating compared to what he's eating now and how much time. So patient has a loss of appetite. 2 months ago was eating 80% of 3 daily meals. Now he is eating 25% of 1 to 2 daily meals with the weight loss of 25 pounds in the last 2 months. So it's a lot more detailed and it explains the actual decline, guys. Steps. If you notice that the patient is getting weaker, let's just not say, patient has a hard time walking. We can say, patient continues to ambulate with a wheelchair, with a walker, unsteady gait, at risk for falls, patient holds on to furniture as he's walking, patient has a hard time getting up and walking, or patient gets dizzy when walking, or patient gets dizzy after 20 steps. We just want to make sure that we're detailed and we explain why it's important for the nurses to come out, why it's important for him to be on this hospice service, right? Like I said, decline. We also want to make sure that nurses, before you document, go back, check Slack. See if there's anything that you might have missed. Because as far as RNs, you're only there once every 2 weeks. So your LVN has been seeing the patient 3 times before you even seen the patient. There might be something there as of last week. So before you document, just go back on Slack. look up, from your last visit, see if you missed anything. You also want to document any kind of infections, if the patient was taking antibiotics, if the patient suffered from constipation. You don't just want to give the same report as you did last week or 2 weeks ago. We need to document decline, or even if the patient got better. And what do I mean by that? It just means where the patient was actually suffering from insomnia, we ordered medications, and you might want to say, patient's insomnia has subsided. Medication was raised from melatonin to trazodone, and patient appears to be sleeping well now. It's not a positive document. It's not that it's positive, but you addressed a symptom where hospice came in. And thanks to hospice, we were able to adjust the medications and provide comfort care and symptom control for the patient. Guys, even if there's forgetfulness, maybe we can give examples of what he was forgetful with. Patient didn't know the day today. Patient was unaware of the month. Patient confused me for a family member. These things are all important when documenting. Our documentation is going to be key on whether, we pass survey or not. A lot of the times, surveyors will look and make sure that your documentation is adequate to what, or right to what the patient's condition is. It's not unheard of for them to see notes and then compare it to the patient. So we want to make sure that everything that we see is documented. Maybe even, patient appears to be slowing down now. Patient's appetite has decreased. Patient's activities have decreased. More rest breaks. Patient is sleeping more often now. They're more tired. They're more fatigued. They get arrhythmia quicker. Maybe even the attention span has decreased. These are all the things. Anxiety has increased. Maybe the patient is now agitated due to the fact that they're in bed more, or they're unable to walk due to weakness, fatigue. We'll all get a little restless if we have to stay in bed, 12, 14 hours a day. So let's keep an eye on a lot of these things. Maybe even increased constipation. The point is this, guys, we just want to document decline, decline, decline. Not a whole lot of positive documentation is needed. We are hospice guys, and we want to make sure that you communicate with your LVNs to make sure that there's anything that maybe you might have missed. Your HAs, look up on Slack. Joining IDG is also a very good way to find out how your patient is doing. And these are all keys to providing good documentation, guys. With that being said, my name is Ulysses. I hope this lesson helped, and just give us a call here at the office if you have any questions or concerns. Thank you, guys.